We told you yesterday about the alarming number of drug overdoses in the past year, with the CDC reporting more than 107,000 deaths in 2021. That set a nationwide record. Most of those cases involve fentanyl, something health officials call a silent killer.
In our new series, Stop the Stigma, 3 News investigator Marissa Sines examines how, more often than not, someone you may know may be fighting that battle and how a worldwide pandemic exacerbated that very problem.
Edward Morrell sits here today, sober, and the better half of what he describes as a full-circle life. But if you dial back almost 2 decades ago, his journey to get here would be just on the horizon.
My mom's name was Linda. Bubbly, very outgoing, generous, just a very kind person.
That's how Linda's life began.
My mom's story ended with a phone call from my uncle telling me that she had died, and we found out that she fell from the 5th story of her apartment building.
The side of Linda's life Edward never understood would eventually muddle his own in the coming years.
She pretty much hid her addiction for most of my life growing up, and I would say, if you don't want to get high, don't put the needle in your arm. If you don't want to get drunk, don't pick up the drink.
This is going to be an overdose.
Linda fell victim to her drug addiction, much like what echoes into a larger epidemic. Despite years of public awareness campaigns and national lawsuits against the pharmaceutical industry, opioid-related overdose deaths just continue rising.
Things got distinctly worse last year.
Fueled by the pandemic and the rampant illegal imports of fentanyl, the CDC estimates over 107,000 people died through November of 2021, marking an estimated 15% spike. In Ohio, roughly 5,454 people died, a 6.5% increase. Closer to home, the rise appears even more dramatic.
It's sad to say, I mean, it's usually at least 1 or 2 a day.
Cuyahoga County overdoses rose from 553 in 2020 to 698 in 2021. This year, the outlook is even more grim. The county is on target for 819 overdose deaths.
What we see, though, is more people, and it makes you wonder, what's the impact of the pandemic and things like that? I think that it's hard to say, why did it go up in 2021 when we had, months of lockdowns and things in 2020? I don't know for sure.
The Cuyahoga County medical examiner, Dr. Thomas Gilson, says the fentanyl phase is what continues to drive this epidemic.
We see cocaine being mixed with fentanyl and sold to all markets.
Responding to incidents firsthand.
Most people aren't having a good time when we show up.
Are paramedics like Jennifer Wager and Michael Land.
I think at this point, almost all opiate overdoses, our first thought is that it's probably fentanyl.
Through the years, the evolution of overdoses comes in life-saving strategies for the two.
Since probably 2017 till currently, it takes substantially more Narcan to revive people.
Through what they describe as waves of calls for help.
We'll go on an overdose, and then our neighboring truck will go on an overdose, and then their neighboring truck will go on an overdose, all within like the same hour and a half.
I don't want those people to be afraid or ashamed to call for us.
I think a lot of people think it's kind of a lost cause.
It's also important to note that these new numbers come just as Lorain County officials warn the public of 2 recent spikes of overdoses, both within a 7-day period. Now, we've listed an addiction hotline on our website, WKYC.com, for anyone seeking help.
Very important story, very disturbing story as well.
Indeed.
All right. Thank you, Marissa.
Sure.